So it's always a pleasure to come back and to give a talk. For those who have seen me over the years, I'm an occupational therapist by background, so I try to help people to adapt to their condition by providing technical aids and things like this. So today, my mission was a bit different than usual, where usually I really do a talk about getting a grip on your daily activity. Now, the talk was really about managing progression over time. And so the key message about progression today that I want you to capture, and I think it was really discussed, and I want to thank the panel and all the audience, because you made my life so easy giving this talk, because everything you talk about is key message in my slide. And I think it's even more powerful when it comes from your perspective and what you live. So I'm just going to bring you a couple more tricks, but most of them have been already discussed. So the key message that I want you to walk on is, yes, I use it, you'll understand later, and I love it, and I help the economy. So we'll make that clear in a moment, what that means. So first, let's talk about progression over time. So you talked a lot about progressions of symptoms. We'll have a word about that. But you also talk about things that you had to give up, things that you had to modify over time. That's what we call in our language participation restriction. So you had more difficulty to get up in the morning, to dress, to work, to go out with friends. And so what we found in research is that if we look at everybody in the room and we ask you what is your most difficult activities, between 21 and 64% of the patient will have severe restriction, which means that they will need human help and adaptation to carry on their activity. And the most affected domain is related to housing, so cleaning the house, getting around the house, mobility, work, and leisure. And we heard that from the panel today. But the things that is, I think, a good message is overall, yes, there will be change, but most of the patient will remain fairly, and I say fairly functional to some level. So you will be able to keep up with your activity for a very long time. Now, what we know from previous study is that, and again, this has been addressed by the panel, the change is usually slowly progressive, and we know that sometimes it's a little bit faster, but then it gets, in a slower perspective. So what we found is that nutrition and personal care, housing, mobility, and leisure will decrease over time. And the thing that is important also to convey, and I think that was also conveyed, it's a familial disease. And so all members of the family will tend to change their routine. So yes, you will be giving up some activities. Your husband may also give up some activities, and your children will also give up some activities, or you will modify them to partly participating. So I was hearing about runners. I was also hearing about working change, changing your schedule and things like this. Now, we just finished a study that will be published in the next few months, so keep tuned. What we found is that for nutrition over 9 years, there was 33% of our patients, we had 115 patients in that study, so a lot of patients, and 33% experienced a decrease. Most of them remained stable in regard to nutrition, and 4% actually had improved. For personal condition, which is keeping fit, 55% show a decrease and 12% an increase, and the other ones stay stable. Then personal care, 37% a decrease. Housing, 31% experience a decrease, and 29% an increase. I'll come back to that. Mobility, 43% show a decrease, and community life and leisures. The highest one, so the one that were very interesting when housing and mobility, and why people can actually see an increase, it was because they started to use technical aids for mobility. So overall, their capacity to walk was less, but starting to use a walker, a wheelchair, a scooter helped them to get their mobility back to a certain level to do community activity or to be more active in their house. The same thing with housing. A lot of our patients move out to more adapted housing, so it was less difficult to do their housing activity, and they also accepted help, which make their life easier, and I'll come back to that. The other thing is that the one that showed the biggest decrease over time was personal conditions, so getting fit, and leisure. Now, whoops, doesn't work, okay. So the main message I want to convey on that study is that as a group, this is a group result, but individually, each patient experienced a different trajectory. So we hear different stories, and they're all very valuable because that shows that there is something that you got power over the trajectory of your disease and your life. You may change a few things that will make your trajectory better. And why? This is because in our mind, in research, what we say is that the way you perform an activity depends on your personal factors, so your level of fatigue, your interest in that activity, but you can also modify some of the factors that are external to you. So you can get an adapted house, you can get a scooter, you can get adapted transport to go to community activity. So, and it was very timely, this speech. It wasn't meant to be like that, it was just a coincidence. But we just came out with that study that I was talking to you, where we really wanted to understand how people adapt over time. So our patient over the 9-year study, we called them back, and we went back to understand what was their trajectory over time of disease progression, and what things were helping them and what things were barrier. And so what we can do to make things better, so that's what I'm gonna be talking. And what we did also, which is very exciting right now, is that we get a panel of expert patients that are following us in every of our study. So they are kind of researcher with us, and they're helping us to get better answer. And they were part of that study as well. So some key factor that we've learned. So a lot of people talked about muscle strength, and this is a key factor. When we look at statistic, when we try to explain it from a statistic perspective, we found that muscle strength is a key factor, and there's thing, and it will influence also how the disease will progress. So things that you can do to help is a formal assessment by your rehabilitation team. Learn to see technical aid as a way to make things easier. Over time in our clinic, we follow 500 patients with myotonic dystrophy type 1. A lot of our patients over time had difficulty to adapt to getting a cane, a walker, a wheelchair. But a lot of them, when they started to use it, not on a permanent basis, but just as, okay, I'm going to the shopping center, I'll make the choice of using my wheelchair so that I've got more energy to shop and, to go with friends for a coffee. So they make choices about when they're gonna use their wheelchair. And a lot of patients came back and say, if I knew how more autonomous I got with that technical aid, I would have accepted earlier. Not for all of them, but for a lot of patients, that's the case. So my advice today is just try it. You can refuse it afterwards. You can leave it in the closet. I'm not saying it's a good thing, but just try it. Try things before saying no. And as part of the disease, you've got cognitive issues that give you some rigidity. You have trouble to change your pattern, and that's a CNS. That's a thing that happened in your brain. So force yourself to try it out. And if it doesn't work, put it in the closet. I mean, I'm an occupational therapist. I see a lot of closet full of technical aids. I'm used to it, but just try it. Give it a try. Keep active. I mean, how many patients said that keep active is a key factor? It will help your muscle. And stay tuned. We just finished a muscle strength training program with our patient, and it works wonder. And what the panel says is that not only it helps with your muscle strength, they say, I got less fatigue. I mean, it's kind of crazy thinking that because you're fatigued and you're going to train. No, it gives them more energy and they felt happier. Nutrition is a key building block. I told you, everything was said this morning. I don't know why I'm upstage, okay? And my main message is muscle needs protein. Junk food doesn't have proteins. Please overeat proteins. Get your doctor, your nutritionist to give you a plan. And even if you have trouble swallowing, there is way to get better nutrition. Now, fatigue is another key factor. And no, it is not usual fatigue that people experience. It's a different kind of fatigue. You're overly fatigued, and it's not because you're lazy, it's because you've got some involvement of your brain. Things that you can do. Formal assessment by your medical team. Medication has been told, because a lot of our patients actually take Ritalin, or how you call it here, modafinil, or things like this. Sometimes it's helped for hypersomnolence, but we found that for some patients, they relate it to fatigue. So it may work, and we don't know why, but some patients take it for fatigue, some for hypersomnolence. My main message is energy management, and I think we've heard that from the panel. Choose your activity carefully. Plan your day not to overdo it, and to choose the most meaningful activities. And it's not energy only on you, it's energy of your family. So plan activities so that everybody feels that they have a sufficient level of energy to perform. Medication may help, and nutrition, again, will help with your fatigue level. Because if you're not well, if you don't have a nutritious meal, you will have fatigue. And adapt your activity and be inventive. And I'll just give you a trick. I have always a lot of tricks. I use that myself. I love it. It's pre-cut vegetable. You got it for chicken pie, for chili, for spaghetti, and it's quick and easy. So you don't have to cut it. So the time you save to cut vegetable, then you get more time to do something else more meaningful. Because let's find it, nobody finds it exciting to cut vegetable. I don't, personally. Hypersomnolence, it's not something in your head. It's not something you're making up. It's also a key factor so that you have to fight and you have to treat. Again, medication may help. It may progress over time, but it doesn't progress, very rapidly. But the thing is that you may before not have been hypersomnolent, and you're starting to be hypersomnolent. So we see patients that haven't shown hypersomnolence for years, and they're starting to show hypersomnolence. So be aware, and and you can manage it. And again, nutrition is key. Now, organize your life differently. So, yes, I use it and I love it, so I'll be talking about technical aid again. Nutrition issue. The ability to prepare a meal will be more difficult because of the strength issue, the fatigue, the apathy, and eating will be more difficult because of dysphagia. Two things, you modify your role during meal preparation. So I take great pride of preparing meal as a mom, but I've realized that I cannot be full-time working and doing all the meals. And now my teenagers are getting involved, my husband is getting somewhat involved, he's learning, but also agree that, okay, sometimes I'm gonna buy some prepared food, and sometimes it's not gonna be the most delicious meal that I used to do because I don't have much time anymore. So you need to modify your role. One thing that I found very cool now is the delivery solution. So a lot of my friends are using it. You receive everything in a box, and you just need to cook it. So, and it's delivered to your house. So it's really cool. If you're not like, I felt that it wasn't that expensive portion-wise. We're not huge eater, but still we can, it's manageable and it's really neat. Can't remember. It depends on the meal, but usually it depends. It's between $3 and $5 per portion. So it's not the everyday meal, but it can be a great solution for that. And there's different solutions in the US. This is a Canadian one. That's what I showed because I didn't want to promote anything in the US, but it's a Canadian solutions. And it's really great. And sometimes the things are pre-cut, so it makes things easier again. Now, And so I use it, I love it, and I'm helping the economy. Someone is actually working because I pay for it. So I love it. Yes, someone helps me clean my house, and I love it. And it's been shown that people that get helps to clean their house have better participation overall because they do something more meaningful than cleaning the house, okay? And for those who are not working and feel that since you're at home, you should be doing all the cleaning, well, you're actually working very hard on your disease and you're helping the economy, again. So, energy conservation, get stuff reorganized in your house. Get stuff out, okay? Everything that is heavy, take it out. Buy something light. It's easier on your muscle. It'll make a difference. Everything that is low and high, change it. There's a way to do it. If you want to know, get my previous talk on the Academy, Digital Academy. Plan for the future. So you move to a new apartment and a house, please, first floor, easy access to the house, master bedroom on the first floor. And this is my key for Elizabeth. This is my new friend. This is my best friend. This is something that it's a vacuum cleaner that worked by itself. I've got it on my app, and it says, okay, I'm starting to clean your house. And I'm getting recharged, and I'm going back to clean your house. So that's a vacuum cleaner, and it works by itself. It's marvelous. So there's dozens of things that you can do when you start looking at this. Walking issue, keep fit. Even more important than ever, keep your muscle mass and also your respiratory function. Make sure that you keep it as good because it's highly related to endurance. So people that have less good respiratory function, they will tire more easily. Physiotherapy, walking aid, risk of fall, environmental barrier is very important. And walking versus energy conservation. Make the most of your walking that is left. If you're gonna feel tired, use your wheelchair, use a scooter, use any help you can so that when you walk, it's for a significant activity. It's for a walk with your friend, it's to go somewhere where you cannot use your wheelchair or your walker. Please make significant use of that. And the other thing that is very cool that I love is the shopping now. They do your shopping, they put it in a box for free, you press the button, and the guys come to deliver it to your car. And you don't have to move, So when you forget, you just click, and you say, I need this and this and this, and they deliver it to your car, and then you go home. So again, a perfect way to save some step. Community activity. Something I knew for so long. I started my PhD by going into 200 House of Myotonic Dystrophy patients. And please identify that as a research priority. The main key factor that prevents community activity is GI tract symptoms. The bad days, the good days, all the problems with GI is a key symptoms, and there's not much research out there. So please make it a research priority. Obstacle in the environment and walking capacity. Now, we also interview patients to understand how they perceive this. And we found several facilitators. Disease acceptance is the biggest facilitator. All of our patients say that once I had accepted my symptoms, it was much easier. So having said that, it doesn't get overnight. I think we had really good speech from the panel about therapy, about medications, about anything that can help you, yoga, meditation, whatever is to help you. May be variable with time. So accepting the disease is not okay, I've accepted it and it's going well. You will have phases, of acceptance, but you need to identify those and, go to have some help. The use of technical aid with that. The other thing that really much help, according to patient, is your long-term relationship with your medical team. That is very important because they know your disease, they know your family condition. Now, having said that, oftentimes the medical condition or the medical team is not that, versed into myotonic dystrophy. But now we just came out with the consensus. I hope I'm not selling something there. I hope you know about it. Yeah, you've heard? Okay. So we just came out with the new consensus-based care recommendation for adults with myotonic dystrophy. You'll hear about this afternoon. And this is very important because if you're in a medical condition and your rehab team or your medical team doesn't know what to do, then it will get worse. And one of the panelists says, you don't be sick, and it's true. One of the things that the patient said that was a trigger point was hospitalization and decreased general health is a key factor that increases the progression of the disease. So it takes more time for you to recover. So it's not just about your myotonic dystrophy symptom, it's about just good general health. So keeping fit, nutrition, etc. Physical help from the family was also a big help, and motivation and psychological support from family and friends. The other thing that was highly important according to patient is service proximity. So plan this if you're moving. And we did a small study where we actually look at patients. So that's a map of Saguenay in northern Quebec. And what you see in red is where the distance is more than 20 kilometers from a general practitioner. And in green, it's less than a kilometer or 2 kilometers. And so we define for our patient where are the service-rich environment. So what we've shown is that, let's say, the neuromuscular clinic, 42% of our patients are within a kilometer of that neuromuscular clinic. I know it doesn't happen in the States. It's only in Saguenay. That's a unique thing. But then, if you go at the grocery store, 49% are between 1 and 5 kilometers. 60% of our patients do not drive car. So 1 to 5 kilometers is quite a distance to walk to go to your grocery stores, or your pharmacy. So if you have to move out, try to figure out where will be the place where the most services are closest to you, and that will make your life probably easier. Now, some barriers. Snow. Saguenay specific. This is my house, and it was in end of March of last year. Okay, so when we mean snow, okay? And there was the front of my house, I couldn't see, Fear of falling, very important. It will be a barrier to all of your community outing. You will and it's an insidious process. You won't realize it. So please discuss that with your PT and find solution. Stigmatization was a main barrier. A lot of our patients thought about when I go outside in the community, I feel stigmatized. And again, with therapy, with talking to your medical team, you can help overcome this. Loss of the driving permit is also a thing. Apathy is a big factor, and a lack of support from family. Now, keeping up with progression. So I use it and I love it. Try any trick and be proud to use it because you're making more time for a more significant thing. That's the only thing we do. I do it too when I get things delivered at my house. Being assertive, okay? Practice what to say when hearing unwanted advice, criticism, or insensitive comment. And that was from the MDA trick. So that means it's your choices of your technical aid, of how you manage your disease. And sometimes people may feel that it's not the right solution, but be assertive about your solution. And that's probably what you think is the best way to handle the situations. And that's it.